Well, hello there, future nurses. Welcome back to Med Monday. We're going to go ahead and jump right in and get started today. So, our medication today is citalopram or Celexa. The functional class is antidepressant, and the chemical class is an SSRI. This medication is given orally, and it works by inhibiting serotonin reuptake in the CNS. It increases the action of serotonin, but it does not affect norepinephrine. Now, the indication for this medication includes major depressive disorder. However, there are unlabeled uses, and that includes OCD, obsessive compulsive disorder, post-traumatic stress disorder, PTSD, panic disorder, social phobia, anxiety, and premenstrual dysphoric disorder. This medication is contraindicated for hypersensitivity, but we can give it cautiously in pregnancy and breastfeeding to our geriatric patients, for renal and hepatic disease because it affects the clearance, for seizure disorders because this medication can cause seizures if the patient has serotonin syndrome, patients who've had recent MI, bradycardia, and QT prolongation. Side effects, and remember, side effects are non-life-threatening. This includes insomnia, agitation and anxiety, sedation, dizziness, headaches, poor concentration, palpitations and chest pain, first-degree AV block, bradycardia, nausea, vomiting, diarrhea, constipation, weight gain or weight loss, male sexual dysfunction, increased sweating, and rash. Oh, and hot flashes. So adverse reactions, remember, these can be life-threatening, include seizures, neuroleptic malignant syndrome-like reaction, serotonin syndrome, suicidal ideation, hemorrhage, MI, QT prolongation, torsades, and neonatal abstinence syndrome or withdrawal. Now, nursing considerations. We want to monitor our patient for serotonin syndrome. We want to monitor our blood pressure lying down and standing up. If there's a change of more than 20 drop, we want to hold the medication and contact our physician. We want our patient to weigh weekly because they may have decreased appetite. We want to monitor them for dry mouth. This is probably the most common and it's very annoying. We want our patients to test for pregnancy prior to administration. And we want to get a baseline EKG to look for prolonged QT segments. Now, we're going to be teaching our patients that the effects may take up to 6 weeks to be felt. We want them to use with caution when driving or performing activities that require alertness because it can cause drowsiness and dizziness. And this may subside as the medication regimen goes on. Dry mouth may occur. We do not want them to discontinue usage of this medication, especially if they've been taking it for a prolonged period of time. If they feel that this is something they don't want to take, then they need to discuss this with the physician, and then they start to taper the dose. We want them to avoid alcohol, contact their physician if they're having suicidal thoughts. We want to teach them the signs and symptoms of serotonin syndrome, and we need them to notify their prescriber if they become pregnant or they intend to get pregnant. As always, we want to tell our patients to take this medication as prescribed and to consult the pharmacist or their physician before taking any over-the-counter or herbal supplements. So that's it for this week's Med Monday. I hope this helps you guys out a lot, and I hope you have a great week, and we'll see you next time.